Welcome. My name is Bill Berkowitz and I'm the Regional Development Consultant for Ideal Protein in California. Listen to a few of your colleagues describe how Ideal Protein is delivering outcomes as an effective population health and triple aim tool. You will hear a common theme in these physicians' experiences. Ideal Protein delivers clinical outcomes that are predictable, repeatable, and measurable. Ideal Protein is a medical weight loss protocol developed by physicians to address obesity and the underlying issues of metabolic syndrome, hyperinsulinemia, and insulin resistance. Listen to these physicians share their experiences with Ideal Protein.
We, through the years, have noticed that a common thread through our ill patients was that they were overweight. And no matter how much we encouraged them, and no matter how many different diet plans we sent them to, we found the weight loss to be incredibly ineffective. The Ideal Protein diet is different than other diets, not just in the diet itself, because scientifically it's a bit different than the other diets in that the degree and the restriction of carbohydrates and the degree and the restriction of fats. But the real difference is how the diet is instituted. We give patients frequent monitoring and coaching, and it's not just coaching to maintain the diet, it's monitoring their medications, it's monitoring their vital signs, and ensuring that they are adjusting their medications and adjusting their lifestyles in addition to adjusting their diet.
The physicians in the group are completely supportive of this program. They have seen tremendous changes in people's health, reducing their medications and just giving them back quality of life. Our focus now, as with everybody else, is the triple aim, better health, better care, and lower costs. And this really helps us achieve that goal with our patients. It's nice when we can actually see a patient come in and they say, I just feel better.
The Ideal Protein diet allows the ill diabetic, the ill heart failure patient, the ill osteoarthritic, the ill hypertensive to essentially be free. That's the benefit, is that they're freedom from the ravages of diabetes, freedom from the ravages of morbid obesity, and freedom from multiple medications. And in essence, the major benefit of the diet is freedom.
The other physicians have sent patients to us. Sometimes we share patients because we are a multi-specialty group. And when they see the results, they've called and said, we want to know more about it. Can you send us information? Can you come speak with us? And then we've seen them send more and more patients to us. I would say this is a no-brainer to bring this into your practice because of just all the way around, from an administrative financial perspective all the way through helping our patients feel better. And that's the main goal, and changing their lives.
I heard about Ideal Protein after my partner came back from a GI conference, one of our national conferences, Digestive Disease Week. It was promoted there, and he brought it back to our practice and has implemented it into the practice, and that's how I found out about it. I had many questions about Ideal Protein when I first heard about it. The first was the mechanism of how it works. Once knowing how it worked and the ketogenic state that it puts you into, that answered a lot of my questions, and in fact really got me excited to do it because the science behind it works. For other groups wanting to offer Ideal Protein, it is a winner on many fronts. It's a winner on patient health first and foremost. I can tell you as a physician and as a patient, especially a cardiology patient myself, I spent years having physicians tell me, you need to lose weight, you need to lose weight. But no physician ever offered me a plan. No physician ever told me how to lose weight or guided me through any particular program. It was always, you have to lose weight, and then you go out and find your own methods. And that's what I liked about Ideal Protein. It gives you a directed way, a scientifically proven way to lose weight.
Medical Surgical Clinic is a 40 physician, almost 50 medical provider, true multi-specialty practice. We have 8 physical locations in Irving and Las Colinas. And actually, I sort of stumbled upon Ideal Protein at a Texas MGMA meeting. And when I met with the representatives who were there, I was just intrigued by the science, and then understanding more about the protocol itself and that how well it was laid out and that it was physician developed, and all the science that was behind the program and why it was so successful.
I've been at the Medical and Surgical Clinic of Irving for about the last 11 years, practicing general internal medicine. We see a lot of improvements in our patients' health that have been on these programs. Specifically, marked reduction of blood sugar values and hemoglobin A1C levels, sometimes into normal ranges, and medications can be discontinued or greatly reduced. We see improvement of blood pressure and especially lipid profiles. The changes you see in triglycerides and LDL values in particular are amazing.
Clinically, our physicians have been incredibly impressed with the outcomes that they've seen from their patients that have participated. Reductions in the need for hypertensive medication, changes in the need for diabetic medication, cholesterol medications and such have just been incredible. We've probably served in excess of 1,000 participants up to this point, and the doctors are just incredibly impressed with the outcomes.
When your physician goes over a weight loss program with you and tells you, I expect that you're going to have this amount of weight loss over a certain amount of time, and that happens, there's a great deal of satisfaction for your patients in that. And they're much more likely to stay on path and stay on track with this healthcare journey.
A program like Ideal Protein is really going to provide the physicians with an opportunity to address some of the things that are confronting the healthcare industry as a whole. Then move toward patient-centered medical homes, toward accountable care organizations, quality-based reimbursement. All of those things are that they fit so synergistically into what Ideal Protein brings to the practice.
I have been in practice for 34 years, and over the last decade, observing patients coming into our office with obesity and other related comorbidities, we decided that we need to attack the problem at the root cause, which is creating such a complicated mess for healthcare. So I sat down with my office manager, and we both felt that we have to address this issue of obesity, and Ideal Protein was one which we looked into. She had tried other types of diets which had not worked that well for her. So she became the first guinea pig for IP. And the success which she brought once she went into the program, we decided to roll out the program for our patients.
The impact that Ideal Protein has on our patients is absolutely amazing. I have seen people that have come in that feel like there's no hope, and after they start with the program and realize that they are losing the weight, they then become more motivated to succeed, to reach their goal, and it's just absolutely amazing feeling to see that happen.
The results of our IP program, since we started February 9, 2012, we have served over 600 patients. 300 patients are actively being managed in the IP program. Pounds lost 11,576, inches lost 11,363. Majority of our patients now have their diabetes under control, their blood pressure under control, and significant reduction and even elimination of medications for a lot of our patients.
I became interested in offering Ideal Protein through my own personal experience. On one day, I had a patient that was a physician, and then also a patient later in the day that was a nurse. Both of them looked incredible compared to the year before, and one of them was off her high blood pressure medications. And until that day, I'd never heard of Ideal Protein. And then on that day, heard of it from two patients that also happened to be medical practitioners. I felt like this was a program I needed to look into. I think the benefits are that you're going to see quick weight loss, which really encourages the patient to stick with it. It's a great fit for your practice. It helps you better serve the patient. We are here to help patients, not just to distribute medications. This allows us to have food as a treatment, to reduce the risk of metabolic syndrome or treat it if it's there already, reduce the cholesterol, improve the control of the diabetes, even if they're a type 1 diabetic.
As you've heard from a few of our provider partners, the Ideal Protein Protocol delivers you, the physician, clinical results that are measurable, predictable, and repeatable. How can you see this program impacting your clinical practice? Contact me to schedule a 20-minute call to explore the comprehensive Ideal Protein clinical and business model and to answer your questions. You can call me at 805-305-0884 or email me at wberkowitz@idealprotein.com. I look forward to speaking with you.